A warm welcome to ProDog Raw's podcasts, where I, Caroline Spencer, ask the experts about a variety of natural and holistic health alternatives for your dog's health and well-being. Now, today the conversation is supporting dogs with joint and mobility issues. So joining me shortly is the world-renowned holistic vet, Dr. Nick Thompson, who's a raw feeding advocate and founding member of the Raw Pet Medics. So we're talking through prevention, signs, symptoms, treatment, management, using a holistic approach. So without further ado, let's jump in to today's podcast and meet Dr. Nick Thompson. Hi, Nick. Thank you so much for joining me today. Such a pleasure always to catch up with you and pick your brains on all things dog related.
Great to see you, Caroline. We haven't spoken for a while now. Well, it must be, 5 or 6 months, maybe?
Yeah, I can't remember the last subject we were speaking about, but
No, I can't. I
this
think it
is
was
a really
desperately interesting, whatever it was.
yeah, absolutely. As is this one, because it's all about sort of joints and skeletal issues, which plague so many dogs, doesn't it?
Well, they say the only things you can guarantee in life is death and taxes. I would go one step further and say death, taxes, and arthritis.
Yeah,
Yes.
yeah,
It's an absolute guarantee. Every dog, if they are spared long enough, will get arthritis, just as you and I absolutely will if we're spared and we don't go under a number 10 bus. Tomorrow, your joints will wear out. They are a very, very clever mechanism which wear out. That's just
yeah,
a fundamental thing. And the more you use them well, the longer they'll last. But the more you use them, the more there will be wear and tear and inflammation and what have you. So I think it's one of those inevitable things that it's like, guys, the dog is kind of midlife, doing absolutely great. Shall we start maybe making some changes towards preparing for degenerative joint disease, as we used to call it?
yeah,
Just shall we start taking some action for wear and tear? Yes. When is the best time to start taking action for wear and tear? The answer is how you feed mum. Yeah. From before conception, that's when your journey, your conversation with nutrients and with inflammation really, really starts before conception. But in the real world, I think starting as early as possible. But if you're not of that mindset, then I think then at the very least, kind of midlife would
yeah,
be a good place to start.
yeah. And also, I suppose it's not only kind of the food we feed and the supplements we give, and
Mm.
changing how we are kind of midlife before things start going downhill, but it's a lot to do, as you say, with the birth mother, but also the genetics and
Genetics do play a
how
part.
how
Yeah.
we how we how we breed our dogs and how we bring our puppies up. So when we get them from 8 weeks, I see an awful lot as behaviourist, awful lot of over-exercised, overstimulated puppies who are jumping up and chasing balls.
Yeah. Yeah, absolute nightmare. Now, so there's a couple of things you said there. So number one, genetics is yes. So try and choose mum and dad as carefully as possible. Very often that is not possible. You just you see somebody somebody's having puppies online. They look great. They're raw fed. That's really fabulous. But you haven't got a lot of control over the genetics. What you do have control over is those two things that you've, one of which you mentioned. So you've got big control over diet, and you've got big control over the environment and exercise. So as far as diet is concerned, there is some work coming out of the dog risk um, department at Helsinki University, and they did a small study on German Shepherds showing that there is a reduction in negative hip scores if their dogs are raw fed. So there's a lot to be said for feeding raw food. Surprise, surprise. You knew I was going to say that, but
Yeah.
I'll say it anyway. There is a study. The other thing is that if you've got any dogs at all, but any bigger than kind of 10-kilo dogs, and you've got the most beautiful parquet slippy flooring throughout your house, you are absolutely asking for hip dysplasia, for problems with malalignment in the spine, where their legs go that way and they go that way as they go round a corner when they're chasing the postman. So I think that until maturity, at the very least, get some mats down on that beautiful parquet flooring. It looks rubbish, but it will protect pup as pup becomes junior becomes adult becomes senior becomes ancient senior, and I hope into very, very late and productive and pain-free life. So I think those are really important things to do.
Yeah. Well, I suppose sort of wooden floors and everything would be like us walking around with socks all the time.
Yeah,
How
totally.
do you
Or
feel,
on
and what does that do to your joints and falling over left, right, and centre?
Yeah, and if it doesn't get your hips, it's definitely going to get your ankle, your wrists as a human.
Yeah.
Like falling over in an ice rink.
Yeah.
It's going to have an effect somewhere along the line. There aren't many parquet floors in nature. Last time I looked, so skiddy environments are very, very rare in nature, apart from maybe the middle of winter in Scandinavia and places. But
Yeah.
then deer don't tend not to go on those because they know it's going to be risky, and therefore canids tend not to follow them. So I'd say almost we don't see skiddy environments. So skiddy environment is just bringing on early inflammation, degeneration of joints. It's just stressing those joints more than they need to be.
Yeah. I suppose a bit like jumping in and out of a car rather than lifting your pup in and out.
Yeah,
And just kind of thinking common sense, really.
yeah, I think so. Yeah, I mean, if you got a rotty, you're not going to be able to lift puppy in
No,
and out of the
probably
car
not.
for very long. But if until maturity, we humans tend not to push our children into marathon running. Okay, and there's a reason for that. And so I think that's important. But Ian Billinghurst, who's the godfather of raw food, he always says, play, not exercise,
Yeah.
when they're puppies. I think it's good for them behaviorally. That's your department. But physiologically, I think that's a really good idea. Get them out and get them moving all the joints and all the
Yeah.
muscles and learning their coordination, but don't thrash them. Don't, take them for 10 milers, 20
Yeah.
milers. You're going to have the rest
Absolutely.
of their life to do that. So don't do
Yeah.
that initially. Yeah, for sure.
Yeah, it's about moving naturally, isn't it?
Yeah.
Rather than overstimulated, overexcited, just, being peaceful and finding out about the environment and
Yeah.
balance and all the rest of it in their own time, rather than us sort of wanting an adult before they've gone through all the growing up mentally and physically.
Totally. And puberty is the big flag there. It's like, do stuff after puberty, okay? Because then that they have a certain degree of maturity of their musculoskeletal. I would leave them beyond, but if you want a really easy flag, think of when they hit puberty, and puberty is going to be, the bigger the dog, the later that's going to be. So it's going to be depending on the size of the dog as to when that kicks in. If you don't know, just look it up. You will get a rough guide as to your particular breed. Some of them are a bit are small, but a bit late to puberty. Some are a bit big and a bit quicker, just because of physiological quirks. But generally speaking, you'll be able to find out where you're aiming for and hold your horses. You've got the rest of the life. their life to
Yeah.
exercise their legs off.
Yeah, absolutely. Because you've got to be really careful of the growth plates and also
Yeah.
immature
Yeah.
tendons and ligaments and all the rest of it.
Yeah. Yeah.
And is it?
And also, talking about growth plates, try eat with all your strength to not neuter them before puberty. I think is the trick, and really run a mile from really early neutering. And I'm talking really early, like 9 to 12 week old neutering. That's just an absolute nightmare
Yeah.
for
Is that happening?
musculoskeletal.
Crikey, is that happening? I know it's happening in America. Is that happening in the UK, Nick?
I believe so. With
Golly,
Labradoodles. Yeah, yeah,
crikey, I thought
I
that got
believe
up
so.
nut because when I had my first dog as an adult, that was over 30 years ago. I was told, yeah, neuter, 6 months old. So, without knowing any better, I did.
Sure. Yeah.
And he had, you know, he was a Labrador. He had hip issues, and
Yeah.
really at about the age of 5. And that was really sad. And it wasn't until 15, 20 years ago I
Mm.
started really delving
Yeah.
deep into the real dog rather than
Yeah. Yeah. You're born with gonads for a reason, and I wouldn't
yeah,
depart from them until
yeah,
well after puberty, and not at all if you can help it.
yeah.
That's
Well, I
the
always
way
say
we're
to
going
people,
nowadays.
yeah, yeah, they always say to people the only animal I would castrate sometimes is probably my husband. But yeah, if it's
Right,
not
I'm not
Bluetooth,
even
like,
not going to
I'll
say anything.
I'll have a chat with your wife about that one. But anyway, so oh, that's really sort of, yeah, because prevention is far better than cure or management all the
Sure.
time. Of course, there are going to be reasons with the best will in the world. We can't avoid everything. Um, so yeah, just purely getting old does it to all of
Yeah.
us. But
Yeah.
what are the most subtle signs and symptoms? What are the first things we might notice of a dog in some difficulty?
They are, I think, talking really early signs. So, I mean, if we've got a 15-month-old lurcher and he will go hooning around a field and will come back lame. Yeah.
Yeah.
3/10 lame. Okay. We measure it from 0 is going to the Olympics. 10 is you can't even put your foot to the floor. Okay. That's a 0 to 10 scale. So he will frequently come back 3 out of 10 lame. And therefore it's pretty obvious. If though, and that's fairly, if they're dotting one, carrying one, that's pretty
Yeah,
obvious. Less obvious behind than in front. If in doubt, get them checked by an external party, a physio, the vet, whoever it might be, your next door neighbor. Just say, am I seeing things here? Is there's something going on? The other kind of more subtle changes, and if we're talking arthritis, we're talking long-term gradual change, as opposed to being hit by a bus and having a broken leg and being lame
yeah,
because you've got some kind of structural damage. Okay, so this is a different kettle of fish. And so at first it's going to be maybe they're just getting a little stiff after rest. I think that's perhaps one of the first things to see. And other things would be perhaps just a slight change in gait. Maybe
right.
if previously they were walking fairly straight, maybe they're walking on a bit of an angle, or maybe bananaing a little bit, if you know what I mean.
Yeah,
Just to they're just kind of favoring one leg above another, maybe a front leg, maybe a hind leg. If you see any nodding, the normal dog, the head doesn't really move at all but if there's any kind of little nod, it means that you've got a lameness, a very subtle lameness. So those would be some of the early signs, and I would be looking out for those from about middle age. Again, big dogs, middle age is going to be a lot sooner than the
Yeah.
our
Yeah.
smaller canine friends.
Yeah. So, so looking out for those signs and symptoms and your
Yeah.
behavioural changes and
Yeah.
how they walk and how they get up after rest, would you be adding some supplements or something into their diet before you get to middle age for support?
Totally. So, well, if you start seeing any of those signs, that is a big calling card for I need some support. Hopefully, you've kicked in with that stuff maybe a year before you see those very subtle signs. So, I think it's better to start a year too early than a year too late.
Yeah.
Okay, with those things. So there's a few things to say. I think that osteopaths and chiropractors are worth their weight in gold, and to have one who you see every year or so, if dog is absolutely fine, and also that you can call upon if dog goes a bit lame and it's not resolving quickly. That's very useful. Or if they have surgery, because you know what happens, especially with big dogs, is you've got this enormous dog and you've got two tiny vet nurses who have to take dog from the operating table and put them into a kennel,
Yeah.
which is usually at the bottom because they're a big dog. And so you have to go from table height down to bending height. And with the best will in the world, that you lose a head, or you can get a bow in the back halfway between nurse at the front,
Yeah.
nurse at the back. And that can put your back out, put your neck out, put your hips out, and what have you. So, our post-surgery for anything, post-surgery for, taking a lump off a nose. Okay, you think, well, it's got nothing to do with the legs, but actually, it can jar that
Yeah.
musculoskeletal system. So,
Yeah.
find a really good, either an osteopath or a chiropractor in your local area, and
Yeah.
make use of them.
Yeah, I suppose it's a bit like us. We only go and see the chiropractor, osteopath, or have cranial sacral massage or whatever it is when things have gone wrong. Now,
Yeah,
if we look after ourselves,
yeah. Prevention's better than cure, as you said earlier, Caroline. Absolutely. Don't wait till the car breaks to go to the garage. Go for an MOT, on a regular basis.
yeah,
Yeah, for sure.
yeah, because I do find there's lots of people who are doing sports with their dogs, and they're very clued up on the osteopathy and the hydrotherapy and supplementation, and a lot of the ones that are eating ProDog, actually they're dogs, not them. They put flex into their dogs their dog's diet. Um, when they're very young, they're starting their agility at about, well, I don't know, competition about 18 months old, because before that,
Yeah,
they're not mature enough, isn't it?
yeah, yeah, definitely. I mean, I've got some here. I've been looking at it recently, and we've very recently just started selling it on the shop, and I think it's a great thing. Should we have a look? I think let's just have a look at that and just see
Yeah,
where you're coming from with that. The first element is MSM, methyl sulfonyl methane, which is an anti-inflammatory. Okay, so that's a great thing to put in there. Um, what happens with raw fed dogs is they get quite a lot of these type of anti-inflammatory products. So you'll see less of an impact in the raw-fed dog than with the kibble-fed dog. And I would be very comfortable giving that kind of product to a kibble-fed dog. However, I would have long chats with owner to try and get them off kibble in the first place. Because as far as I'm concerned, kibble is just like a big flashing beacon saying, please, arthritis, come and settle in this body. The kibble is going to up the level of inflammation of every tissue in the entire body. It's not there's no chondroitin glucosamine in the average kibble type product or even can type product, and so they're just not getting the basics and so these types of products are really useful. So the next product, glucosamine sulfate, great. Chlorella is great because there's a very broad range of minerals going in there, and bones are very mineral dependent. We've got hemp protein, which is great. It's anti-inflammatory, and just if there's a protein boost, especially for those poor kibble dogs, absolutely brilliant. Then we've got chondroitin, which is kind of the cousin of glucosamine. It's a precursor for cartilage. You've got to look after your cartilage, because that's the only thing that stands between you and bone on bone.
Yeah.
Which is a disaster, obviously. We've got curcumin, which is nature's anti-inflammatory. We've got marine collagen there, which again is anti-inflammatory. We've got green lip mussel, which is known as particularly rich in nutrients for reducing inflammation in joints and helping with synovial health and with the health of soft tissues. Boswellia is frankincense, which is a very potent anti-inflammatory, and we actually spoke about that on Raw Pet Medics. I'm going to do a blatant plug for Raw Pet Medics every Tuesday night.
Absolutely.
At 7 p.m. UK time. We get together and we talk about these things. We actually, last night, we were talking about anti-inflammatory products for joints, and we mentioned Boswellia, and black pepper is there, which is a friend of the curcumin to help with the absorption of the curcumin. So, and there's some vitamin C. There's 100 milligrams of vitamin C per 4 gram scoop, I read. And vitamin C, people will say, oh, dogs don't need vitamin C because they produce it themselves. Yeah, and then you give them 2 courses of antibiotics and ruin their microbiome, and their capability for producing B12 and vitamin C and all these goodies goes out the window.
Just
So
plummets, does it?
vitamin C, it's great. It's great. Yeah, I couldn't have got it for your joints, for immunity, as antioxidant. Absolutely brilliant.
Yeah, because we've got some lovely case studies coming up on ProDog Raw website about people who've used Flex and seen some fantastic results. So if anybody's interested, do sort of nip in and have a look there. So yeah, it's really interesting about all those ingredients and, you know, anti-inflammatory properties there to sort of just help keep the body an even keel. So if our dogs present with some slowing down in their old age or some issues and what have you, that whether it's knee, hips or whatever, what investigations would a vet do to establish exactly the cause?
If it were me, I'm just going to speak for me.
Speak for you.
Because a slightly more conventional approach is dogs a bit stiff, here's some Metacam, see how you go. I'm not very comfortable with that, and I'll say it here, I'm not very comfortable with Metacam, Loxicam, Arthrocam, all those meloxicam based products, because I see dogs who get gut upsets because of those things, and therefore I wouldn't use meloxicam. I think it's had its day, and there are, you know, half a dozen other things other products you can use from a drug perspective, and that would be Simaljex, Previcox, Galliprant, these kind of other products. However, the best drug is the drug that stays on the shelf and you don't have to use. So we try not to use those if at all possible. So my approach, if dog is looking a wee bit stiff, would be initially I would be thinking about just a simple addition to the diet, and I'd be getting them off to the osteopath or chiropractor. That would be my first, in order to get an assessment. If anything's asymmetric, just to get things balanced up, and to just any spasm just released. That makes a very, very sensible first start. That would be a good first step. Basically, small. I'll say it again somewhere. Small problems need small answers. Big problems need big answers.
Right. So starting off with some supplement for the diet. If they're on kibble, put them on a great diet. See an osteopath, chiropractor,
Yeah.
massage therapist or whatever. What other therapies are out there for?
Okay. Well, there are many, and so the trick is not to try all of them as soon as the dog gets a little bit stiff.
Right.
What I think if you imagine you've got a wedge, okay, so the thin end of the wedge is down here. Okay, I'm looking in the camera here. So thin end of the wedge is here, and then thick end of the wedge is up here. Okay, so the thin end of the wedge is just the minimum because the dogs are 99% fine, and so when you're down at that early days, I think just getting a good supplement and getting the osteopath, chiropractor, some physical therapy on board. Personally, I do use osteopath, chiropractor. Right. So that's what I do. And then what you do is as the symptoms escalate, which is what will happen in arthritis, you escalate the amount of support. And for me, the drugs and the stem cell therapies of this world come way at the end, and all the other interventions, whether it's hydrotherapy or acupuncture or Bowen technique or whatever it might be, you just layer them on according to the needs and the peculiarities of your dog. I've got sight hounds, and so they don't really like swimming. Whereas if you had a lab, you could get them hydrotherapy, fairly early in the day. Okay, so you've got to look at the individual, you've got to look at the breed, you've got to look at the degree of problem and how fast things are coming on. If they are an absolute lunatic lurcher or a lunatic collie or spaniel, then you've got to kind of protect them from themselves. Yeah, with those guys, you can't just give them loads of painkiller because they won't feel a thing and therefore go herring around and exacerbate that joint inflammation that might be there in the first place. Then again, you do need to offer them some relief from the joint pain. So there's a kind of a balance. We were discussing this last night on Raw Pet Medics. If they don't feel it, they're going to just go running around like loonies.
Yeah.
So the trick is to say, I just want you to feel your joints a wee bit, but I'll take the majority of the discomfort from you. That's kind of where you want to be. And that is a suck it and see situation.
That's really interesting. Yes. I hadn't thought about that actually, because if you take the pain away completely,
yep,
they're going to be as they were when they were younger and cause even more damage and get worse quicker.
This is it. This is why you get stiffer and you get and you reduce your exercise as you get older. It's your body saying slow down because the body is it can't cope as well. So yeah, there is a lot to be said for judicious use of any therapy, but especially the pharmaceuticals, the drugs, because they are very powerful. They can just eliminate pain, and so, like I say, it's a balance.
And yeah, cause more damage in the long run. And I suppose again, it's sorting out your mindset as well, because when you see your dog feeling a lot better, you want to take it for a longer walk, you want to do more exercise. And the thing is just to slow down your pace, just take time just to be in a peaceful place so your dog can just do what they want to do as opposed to putting on your running shoes again.
Yeah, they can mooch. Yeah. I think, when young dogs, like young people, can do miles and miles and miles, and that's absolutely fine. That's great. And as you get older, you're just going to lose the desire to do the miles that you were previously, or you may do those miles, but you do them a lot slower. So you're constrained by time to do a little bit less. And I think it's very wise to really feel in with your eyes, with your mind, with your heart, where's this dog at, and what do they need to really get a really good feel for what is what is required. It's a subtle thing, but let's face it, you're taking them out 2-3 times a day. You've got quite a lot of time to observe change. And if dog is hooning around like a loony, then they're probably pretty good, or it may be that they've got some supplement on board, and that's doing the trick, and they are as new, even though they are a 9-year-old Labrador. If they're as new and they're able to do pretty good level of exercise, well, I'd be inclined to let them do it, because let's face it, for dogs, there's sleeping, eating, and running about, exercise, sniffing, everything as you go. That's it. That is life for a dog.
Yeah, absolutely. And I suppose with using a natural supplement, it's not killing pain, it's hitting the reason, reducing inflammation, which naturally reduces any pain and discomfort, whereas using pharmaceuticals takes away the pain because of all the pathways it goes through to the brain and everywhere else. I don't know much about that, but anyway,
that's exactly right. So what pharmaceuticals will do is they will artificially either remove pain or reduce it, force the body to reduce inflammation. Whereas what most supplements will do is they will aid the body's ability to, at the right speed, reduce inflammation. If you bang your shin on the coffee table tonight, then it's going to be really sore tomorrow, and then a little bit less the next day, a little bit less the next day, and in 10 days, you're going to be good as new. That's the body using the inflammation initially and then saying, right, we'll put 10% less, 10% less, 10% less. Thank you very much. Now you can go and run around the sitting room again. Don't do it again. Pain, this is one of the things that we came to last night, was pain is one of Mother Nature's mechanisms to stop you damaging yourself and to immobilize a damaged joint. Okay, we in the West, and I'm as bad as most, being a bloke, we are very, very pain averse, and I think rightly, the control of pain is a glorious element of modern medicine. But I think with great with great power comes great responsibility. Some superhero said that somewhere along the line, and we have great power to eliminate pain. But in order to wield that power effectively, I think that we need to be very responsible and use that power very responsibly. So where at all possible, if we can use natural products which don't artificially strangle the body into reducing pain and inflammation, if we can help the body do what it wants to do anyway, I'm much more comfortable with that concept.
Oh, absolutely, because we forget the body does heal itself. But
it does, always has done, always will do, to a greater or lesser extent. And modern life is where we have these long-standing chronic non-communicable diseases, in the human population, in the dog population, where the body is struggling to do what it's done for millions of years.
Yeah. Oh, Nick, this is a fascinating topic.
We're going into the realms of philosophy here. We're not kind of sticking to the brief, but I promise you we wouldn't.
But no, it's always lovely. Just delving deeper is always always good. But
looking broadly,
is there any words of wisdom and little extra that you would like to just help people out, just to sort of go because it's a big deal moving to something natural when we've been so used to pumping our bodies with drugs and our dogs' bodies with drugs, to actually take that step. Who could they go and see? Can they get a referral, chat to you about it? Do they have to get a referral from their vet when they're looking for a holistic way to care for their dogs?
Sure, there are holistic vets. There aren't many, but there's probably a couple of dozen around. So, Google is very useful, or whatever you use. So look for holistic vets. There's more and more vets specializing in rehab. So they'll do a bit of chiropractic or a bit of osteopathy, and they'll do a bit of acupuncture. They maybe have a hydrotherapy pool, and they're very, very well versed in all the drugs that you can use. And so this is kind of a new breed of vets. I know of a few. And I think just doing a little bit of Googling, talk to your vet, talk to your friends, talk to people in the park, talk to people on Facebook groups and what have you. These people are around because people are innately suspicious of drugs, and they know that drugs are when they're required are great, but if they're used when they're not required or just kind of convenience, they can be a nightmare as well. They can end the side effects from Metacam, for example, is not pleasant. And we also know that with all these drugs, they will affect your microbiome. And the more we learn about the microbiome, the more we learn that if you dysregulate, you just change the population within your gut by putting this artificial material in your mouth, then you may reap the whirlwind. So therefore, if you're using natural products, they are much less likely to adversely affect that microbiome. Yes.
The adverse side effects either, because a lot of these drugs do have side effects.
Oh, totally.
Whereas a natural product is just supporting your own system to get better.
Yeah, it's not artificially crowbarring your body into doing something. It's helping. So the more natural products, they're helping your body do what your body wants to do. Yeah, because bodies are very good at healing, Yeah. And so if you can just enhance that rather than muscling it to stop producing pain signals, then that's got to be a good thing.
Yeah. Nick, that's been a fascinating discussion. Thank you so much for slotting us into your very busy schedule. Really very grateful.
It's it's an absolute pleasure. It's lovely to talk to you. It's good. It's somehow we always to very dramatic philosophical places. So you inspire me in that way, Caroline. I really appreciate that. I feel very open and very comfortable to really just ponder these things. So that's great. Thank you.
Yes.
Yes, it is busy. My brother's coming around this evening. He's a photographer, and what we're doing is tomorrow we are recording 2 or 3 hours of what makes dogs itch. This is a new video that I'm going to be putting out, teaching people about what makes dogs itch and what you can do about it. So watch this space.
Nick, thank you so much for your time today and giving us such fabulous advice and insightful information about joint and mobility issues in our dogs. If you do have any questions regarding our supplement Flex or any other supplements and our raw food, do browse through our website, or equally contact us at customer-services@prodograw.com. So thank you so much for watching, and see you next time on ProDog Raw Podcast.